Hey guys, it's Louis here from ndxtesting.com, the channel where we give you medical care solutions and bring you diagnostic digitized information so you could be healthy. In today's video, we're going to speak about sleep apnea. We're going to speak about the 12 best ways that you can deal with this condition. Because the truth of the matter is that sleep apnea, if left untreated, you can suffer from some serious cardiovascular disease, including diabetes, and that's something that we don't want. So we want to be able to identify sleep apnea and take care of it. Now, if you do a Google research or a Google search, it states that 22 million people or Americans suffer from sleep apnea. That's a lot, but there's more than that, because sleep apnea, it's a medical condition that gets misdiagnosed every single time. In fact, primary care physicians miss this every single time. And I know it happened with me, because when I was going to the doctor's offices with sleep apnea symptoms, they couldn't pick it up. In fact, it took me 2 years of suffering before I was able to diagnose myself that I had sleep apnea. And if it wasn't for myself and my research and pretty much just praying to God for help, I just don't think that the doctors were going to help me out, and that's why it gets misdiagnosed. And today we're going to discuss the 12 best ways that you can deal with this condition, and I'm going to give you a lasting solution so you can help out. You can help yourself with sleep apnea. So, rule number one: the main thing that you have to do when you have sleep apnea is you can't sleep on your back. You need to sleep on your side. That's going to be the best way that you can beat this condition. Now, what happens is when you have sleep apnea, you compromise your airways. There's a lot of different conditions why your airways get compromised. We're going to discuss that later. But when you can't breathe properly and you don't have the proper oxygen going into your body, into your brain, what happens? You suddenly wake up. And you wake up gasping for air. And you have to wake up, because if you do not, well, I'm not going to tell you what can happen, but it won't be good. So you need to wake up. But you wake up in panic mode and you wake up gasping for air. But guess what? Every time that happens, your blood pressure rises and your heart rate goes up. Normal heart rate is probably anywhere between 50, 60, 70 beats per second, and sleep apnea can definitely skyrocket your heart rate to about 100 beats per second. And your blood pressure can rise, because since your body's not getting the right type of oxygen, your arteries are not getting the right type of oxygen, then you automatically wake up. So you cannot sleep on your back. If you sleep on your back, then it's going to prone for you to open your mouth, and if you breathe through your mouth, then it's not good. So it's better to sleep on the side, elevated position, and try to keep your mouth closed. Okay, so number two, I kind of touched on it with number one. With sleep apnea, you cannot breathe through your mouth. So when you sleep, you have to be able to close your mouth, and you can only breathe through your nose. Now, let me tell you something. One of the main reasons that you have sleep apnea is because you've probably been a mouth breather. You can't breathe through your mouth. There's only two ways to breathe: through your mouth or through your nose. You gotta breathe through your nose. In fact, if you breathe through your mouth, you can get sick. So you have to be able to breathe through your nose. Your body, it needs oxygen. Your brain needs oxygen, and the right type of oxygen that you need is the one that comes from the nose, not through the mouth. So when you sleep, and if you're sleeping on the side, you gotta program your subconscious to keep that mouth closed and breathe through your nose. Because if you sleep on your back flat, it's going to make you open your mouth, and if you breathe through your mouth, you're going to snore, and you can accelerate the symptoms of sleep apnea, and you don't want to do that. So that's one. Number three, what you could do is you can use a nose clip. Now, I use this sometimes. I don't use it all the time, but I use this here, and I put this right in my nose. In fact, I couldn't find my smaller ones. You know, when you order a whole pack of these, you get a bunch of different sizes, and for some reason I lost the small ones, but I could still fit this in my nostril. Now, what this does, it kind of opens up the airways in the nose a little bit, and then more air goes into your lungs, into your brain, into your body. So that's what you need. You need the necessary air. And the nose clip was definitely help. You could do some research on it, and you'll see those nose clips would help. Okay, so that's number 3. Number 4, what you can do is you can go to an orthodontist, and they can make you a device that you can put into your mouth. And what that's going to do, it's going to help you keep your mouth closed, and it's going to push your bottom jaw forward, and that's going to help more air going into your body. Because what happens is, again, people that have sleep apnea, they sleep on their back, mouth open, and what happens? It closes your airways, and then you wake up in the middle of the night gasping for air, and you don't want that. Sleep on the side, keep your mouth closed, and if you have a dental device that your orthodontist made you, that's going to help you keep your mouth closed, and it's going to push your jaw forward so you can have more air going in. So I'll definitely check with an orthodontist if that's the case, if you have sleep apnea. Maybe you snore a lot and your partner or your wife, husband is telling you that you're snoring a lot. Then if you do these things that I just said, number 1, number 2, and number 3 with the nose clip, is going to prevent you from snoring. And then the dental device, then that would definitely help. Okay, at least from snoring, and it's definitely going to help you with sleep apnea. Number 5, okay, what you can do, what you have to know is that it's important that you have proper tongue posture. Now, if this is the roof, if this is the roof of your mouth, and this is your tongue, okay, roof of your mouth, tongue, your tongue has to be flat against that roof of the mouth. You need to have proper posture, proper tongue posture. And if you do that, when you sleep at night and you develop proper tongue posture, if you push your tongue against the roof of your mouth, it's going to elevate your cheekbones, and it's going to elevate your top jaw, and it's going to push also your bottom jaw forward, and that's going to give you a little bit more of space when it comes to your breathing. So it's very, very important that you have good tongue posture, because if you don't, then your tongue could drop, and that's what happens with sleep apnea at times. We end up sleeping on our backs, and then what happens is our tongue drops, and it kind of closes the airways a little bit, and then you wake up in the middle of the night gasping for air. So tongue posture is really, really important. You can look it up, and you're going to see how tongue posture is really, really important when you have sleep apnea. Another thing you can do, number 6, is you can go to an ENT doctor, and the ENT doctor will be able to check to see if you have any obstruction when it comes to your throat. If you have any unnecessary tissue that he can remove, maybe that's a problem. I know when I went, I didn't have any unnecessary tissue. And then he can check your nose to see if you have any obstruction there too. You can have a deviated septum, and you can have something that can prevent you from breathing through your nose, and that's why you're breathing through your mouth. And like I said before, if you breathe through your mouth, then it's not good. You got to be able to breathe through your nose, so the ENT doctor will be able to clear that away. If you're a surgical candidate, and then he will be able to help you in that sense. And then also he can also send you to an orthodontist, or he can also send you to a sleep study, which a sleep study will be able to tell you the degree of sleep apnea. But if you already know you have sleep apnea, then these are the things that you can do. But an ENT doctor, to me, is very, very important, because if he can help you breathe properly, if you have any unnecessary tissue on your throat, or if you have obstruction when it comes to your breathing within your nose. Okay, so ENT doctor is definitely important. Okay, number 7, you can also get I don't have one yet, but I'm going to get one, a sleep apnea pillow. A sleep apnea pillow is key because, like I said, when you sleep on the side, you have to sleep in an elevated position. So a sleep apnea pillow will be able to help you sleep the way you have to sleep, and have the right type of posture, so you don't open your mouth and your airways don't get compromised. So I think a sleep apnea pillow would definitely help. Another thing you could do too, you can get one of those beds that you can, one of these recliner beds. I mean, it's a little hectic, because if you live with someone, if you sleep with someone, you're going to get one of these sleep apnea beds, then that's a little. But if you could get a type of bed like that, then that's good, because you'll be able to lift the bed a little bit, and you can recline yourself, and you can sleep in a good position where the sleep apnea symptoms won't kick in. Another thing that you could do that I do, but it's unconventional. There's a lot of people that would be like, what? I know when I first told my cardiovascular that I use this to go to sleep, he was like, what? But listen, a lot of people do it. A lot of people do it, and I do it. What am I talking about? Tape. Now, what I do sometimes, I was using this tape at the very beginning. I don't use it anymore. I use something else. I use something sleep apnea tape, and one of the if you subscribe to the channel, I'm going to make a video of the sleep apnea tape that I use, and it is amazing. But before that, I was just using regular transport tape. And then what I would do, okay, at first I used to put it like this, but I don't do that. I don't do that anymore. I do it this way. I go to sleep. I could still talk. I could still breathe, and it's not a problem. And this helps keep your mouth closed, and it helps you from snoring. But I mean, obviously physicians don't like this too much, but if you do your research, it's all over TikTok, it's all over YouTube. I mean, mouth tape. I mean, I learned this from top physicians in the industry. Another thing that I wanted to say, listen, I'm not a physician. A lot of people sometimes on the channel, they say doctor. Now, I am in the medical field. I'm a registered technologist in the field of electrodiagnostic medicine. I do nerve examinations and muscle studies and other types of neurological studies. So my specialty is the peripheral nervous system, which is nerves and muscles. I've been doing this about, since 1993, over 25 years. So I know a lot about the body. I know a lot about the cardiovascular system, the autonomic nervous system, and just how to really take care of your body and soul. So just wanted to kind of just throw that out there. I'm not a doctor, but I am a registered technologist, and I have worked with pretty much every single doctor in this field, in the field of medicine. Okay, so we discussed mouth tape. Another thing you could do, some facial exercises. There's a lot of different exercises, and like I said before, if you subscribe to the channel, I'm going to go over these facial exercises. There's so many of them, but I'm going to pick the ones that I do. I'm going to choose the easiest ones, because sometimes you have some miscellaneous ones, some complicated ones, so you don't need to do. The most important thing is to be able to strengthen your bottom jaw here, your throat muscles here, and they could be strong and solid, so they don't collapse. They're not weak, and all of a sudden they kind of fall back a little bit, and it closes the airways, and then you kind of wake up. If you do the right type of exercises, then you're going to be fine. But in the meantime, what I need for you to do, which is really important that I do all the time, is proper tongue posture. Now, if you swallow and you have that tongue hitting the roof of your mouth, that's key. You need to have that every single day. That's the correct position. You can't have the tongue just dancing around your mouth. You need to have a good tongue posture. If you have good tongue posture during the day, and if you have your mouth closed during the day, and if you breathe through your nose during the day, then most likely you're going to do that at night. Most people, sometimes they have sleep apnea and they suffer from these things. They're mouth breathers, and they breathe through the mouth during the day, and if you do that during the day, you're going to do that during the night. Okay. Also, that your room, remember, when you sleep in your bedroom has to be 100% clean. You don't want to be breathing any unnecessary dust. Okay. I know one of the things that I do is I also bring in an air filter, make sure the air in my bedroom it's clean, so I could be breathing fresh air. Remember, this is a breathing problem, so you want to be able to get as much air into your system as possible. You don't want to have air that you can't breathe, because that's not going to help out the situation. You don't want to have a dirty room either. You want to be able to breathe fresh air. So I think one of these small house plants should I have one in my room. Should have brought it out, but it's kind of too late for that. But it's a small little house plant that you can put that kind of cleans the air a little bit, so you can breathe fresh air. I definitely recommend that. And of course, last but not least, a CPAP machine. Listen, there's some people who need a CPAP machine now, but for the most part, those that need a CPAP machine is because two major reasons: either they're overweight and they need help breathing, or they have a severe overbite. Now, I didn't mention the overbite in these 12, but one of the main reasons that people sometimes suffer from sleep apnea is because they have an overbite. But if you go to an orthodontist, they can pick up that you have an overbite. They can fix that. But we're going to make more videos on that. But I have lots of videos. If you go into the channel, I have good videos when it comes to breathing techniques that can transform your life. I have good videos when it comes to that sleep apnea. Sleep apnea, you have to know that it causes anxiety, high blood pressure, a fast heart rate. I have a lot of videos, a lot of information when it comes to sleep apnea. I just wanted to discuss in this video today 12 chief ways that you can take care of it, and you can just release your symptoms, because it's something that you have to you can't live with sleep apnea. You got to take care of it, and you could take care of it. And I didn't mention also, you have to, if you're overweight, then you have to lose weight. But anyway, that's all I wanted to discuss with you guys for now. If you like this information, please refer this video to as many people as possible. Subscribe to the channel. We're definitely going to come out with a lot of different types of information. Also, we're going to bring in different types of devices that can help you when it comes to your sleep apnea. They can help you with anxiety. They can help you with high blood pressure. And when it comes to sleep apnea, we're going to bring in a device that can measure your oxygen levels when you sleep. Now remember, when you have sleep apnea, your oxygen levels drop. Why? Because you're not getting the right type of air. It's almost like having your own sleep study at home. We're going to bring that in. So we're going to bring in a lot of exciting things little by little. Like I said, this channel it's about bringing medical care solutions and giving you diagnostic digitized information. Anyway, guys, with that being said, we'll see you in the next video. Bye-bye.